Hello, friends, and welcome to Pediatric Flow. I'm Jolene, a doctor prepared, dual board certified pediatric nurse practitioner, and I'm so glad you're here today. Today, I want to talk about something that's really important to us all, something you don't hear a whole lot about. It's moral courage. It's the kind that asks you to speak up when it would be easier to stay quiet. But before I go any further, I want to take a pause for just a moment and talk about what moral courage is. Because moral courage often gets confused with something else that we talk about in healthcare: moral distress. Moral distress is what you feel when you know the right thing to do, but you're unable to do it because of barriers that are outside your control. It feels heavy, it feels frustrating, and so exhausting. Moral courage, however, is different. Moral courage is what happens when you choose to speak up anyway. When you act, you advocate, or name the concern, even though it's uncomfortable and there's no guarantee of the outcome. Moral courage isn't loud. It doesn't come with applause, and it rarely feels dramatic in the moment. And most of the time, moral courage shows up quietly. When the room feels calm, when things look okay on the surface, and when something inside you says, this just isn't right. I think about moral courage a lot in my practice. Not as a single moment, not as a big heroic decision, but as a pattern. Something that shows up over and over again in small, uncomfortable ways. For you see, in healthcare, and especially critical care, there are moments when a patient can look stable. Vitals are holding, the monitor isn't alarming, there is no chaos unfolding. But patterns start to shift, trends start to change. Subtle signs begin to point toward risk before a crisis ever announces itself. And moral courage is recognizing the difference between stable and safe. That's the difference that matters. And it's not something you learn from textbook alone. It comes from experience, from pattern recognition, from knowing physiology, and from understanding that sometimes the most dangerous moments are the quiet ones before anything obvious happens. It's what I like to call your gut check. Something just doesn't feel right. Moral courage often looks like advocacy. It looks like respectfully pushing back. It looks like saying, I'm concerned, even when your voice feels a little tight. It looks like asking people to pause and take another look. And let me be honest, waiting certainly is tempting because speaking up can feel uncomfortable. It can feel like you're disrupting the flow, and it can feel like you're being overly cautious or making things harder than they need to be. But sometimes hope is not a plan. Sometimes waiting means missing that window to prevent harm. And moral courage is choosing prevention over convenience. One of the hardest parts of moral courage is that it doesn't feel good in the moment. It feels heavy. It feels vulnerable. And it can feel isolating. Like you're standing in that space alone for a second and hoping others will see what you see. But moral courage isn't about being right. It's about being responsible. It's about grounding your voice in evidence, physiology, and care. and trusting that your role is to speak when something doesn't sit right, even if you don't control the outcome. You don't need to be loud to be courageous. You don't need to be confrontational. And you don't need to have all the answers. For some of the most courageous moments in medicine sound very simple. I'm concerned. I don't think we're safe yet. I need to advocate for this patient. Or something I've done recently. So, just to be honest, I really don't feel comfortable with this patient tonight. Something doesn't feel right, and here's why. Not just saying something feels off, but here's why I feel that way. Here's my evidence and my thought process behind it. My differentials considered. And maybe even a plan. All of these things matter. And when you say them with clarity and respect, they tend to reach the right ears, even if it takes time and even if it takes repetition. Moral courage also shows up in how we communicate with families and how we hold space for fear without minimizing risk. It's how we tell the truth with compassion and in how we present when conversations are hard. Sometimes moral courage means sitting with discomfort, yours and theirs, and not rushing to fix the feeling, but staying honest anyway. And I want to say this because I think it's important. Moral courage does not guarantee outcomes. It doesn't mean everything turns out the way we would hope. It doesn't mean you walk away feeling triumphant. And it doesn't protect you from feeling emotionally drained and mentally exhausted afterward. But it does protect your integrity. And at the end of a hard day, moral courage allows you to say, I showed up honestly. I didn't stay silent when it mattered. And I advocated with the information that I had. And that matters deeply. So if you're listening to this and you work in healthcare or in leadership or any role where other people depend on your voice, I want you to know that those quiet moments of advocacy count. Even when no one thanks you, even when the room feels tense, even when you go home exhausted, especially then. Because moral courage isn't about recognition. It's about responsibility. It's about choosing to speak when silence would be easier. It's about protecting others, sometimes before they even know they need protecting. And if today that required this from you, if you had to say something hard, if you had to trust yourself, I see you today. The world needs people who are willing to do that. It needs clinicians, leaders, and humans who are brave in quiet ways. And remember, the world needs your compassion, your courage, and your light. And as always, until next time, keep shining.